What are some ways that artificial intelligence is used or will be possibly used in pain treatment and management?
Yeah, when we look at AI in pain management, I think it's going to be used in a few ways. I think one is to really help humans understand better when patients are in pain and to help grade pain. And so there's some studies that are looking at voice technology, like when someone calls a physician on the phone or a provider on the phone, can we extract from kind of the tone and the volume of their voice how much pain they're in? There's also facial recognition technology, kind of the same thing. Can we look at someone's face and someone's facial expressions and understand more about pain? Can we turn the subjective into something more objective? Then going forward, kind of can we take all of the pain techniques that we know and better understand when they should be utilized? I.e., if you put in all of the disease processes and all the challenges that someone's having, can AI help us with our decision making so that there's less trial and error, so we're able to offer the right medication or the right therapy for the right patient?
What are some of the challenges to using AI to treat and manage acute and chronic pain conditions?
Yeah, I think one of the major challenges with AI is that I believe people are inherently biased. And AI is really artificial intelligence. So it's artificial human intelligence, so it's based off us. And it learns from us. And so if we have flaws, then those flaws are going to transfer into AI. While I think that AI is such a great tool because it can gather years of experience, it can process things sometimes faster than humans can, but if we feed it with information that's inherently flawed, then the decisions that it's going to make are also going to be inherently flawed.
How are biases regarding race, gender, or class implicated in AI technology?
Yeah, no, that's a great question. And they're implicated because it really just mimics our own biases. And so when we look at there is a tool that looks specifically at risk. So it's an AI tool, has 20 million patient information in it. And it uses that information to deduce, if you look at a patient, how much money is that patient going to cost down the line? And thus, should we be more proactive about care for certain patients who have higher risk? And when you look at how medicine is provided for different races, specifically Black patients versus white patients are a little more proactive about their health. White patients have better access to care. And so when you use a tool like that, a lot of times the white patients will end up getting more attention because it'll look like more money will be spent on them over time as the AI tools kind of draw out those models. And thus, actually, Black patients end up getting worse care because they're seen as not needing the healthcare system as much. But when you actually dive into their comorbidities and their medical problems, those patients, when you lay them side by side, a lot of times the Black patients are a lot sicker. And if you're really proactive, then you actually can get cost savings because those Black patients also get care in less traditional ways. They go to the emergency room. They're often getting a lot more end-of-life care. And so those models don't really work. And a lot of times they're skewed because there's majority, Caucasian country. And so you feed the model with information that doesn't necessarily fit other races or other genders or other sexual orientations, et cetera. And so we have to be really much more intentional about how we feed and create these models so that they aren't being filled with biased information.
In some regard, is there a possibility that AI technology can introduce or foster more bias into healthcare treatment or service delivery?
Yeah, I think it can, because if we think of AI as the kind of be-all, end-all kind of solution for biases, then it's just going to propagate biases. And it's also going to make decisions a lot faster. And so one of the benefits of kind of the human, let me say it this way, the best treatment for biases is to know that they exist. And so there are some unique characteristics to the human mind that you really can't introduce into AI. There was a study that showed that if you do kind of anti-racial education for AI models, then AI basically just flips the other way. And so Black people become the most talented, intelligent, beautiful people on the planet, and then people who aren't Black are should be discriminated against. And we don't want that either, right? And so the truth is really a middle ground. And so we have to be really careful, because as we use these tools, and as these tools don't have as many checks and double checks, because a lot of time AI is thought of as a replacement for humans. And so if there's no one that's watching the decisions that the computers are making, then they can a lot of these biases can potentially go out of control.
Can using professionals of diverse backgrounds minimize biases in AI technology?
Yeah, so we can totally minimize the biases in AI. And a lot of it is really making sure that we are educating the tools the right way. As we think about how we deploy artificial intelligence, one thing that we can do is make sure that we have total sharing of information. And so if we have the ability to learn from each other, then we will be able to create AI tools that are going to be much more functional. But if we create our tools in silos, such that we're all trying to beat each other to make the best tool, then we're not going to learn from those mistakes. Because as we talked about anti-race information or anti-racism information in AI and how that can flip AI, sharing that across broadly is going to prevent us from potentially making big mistakes when it comes to creating AI tools. And so the other is using really big data sets. And so instead of just looking at the city of Las Vegas and their demographics, or even the United States and their demographics, we should be looking at big data sets, world demographics when it comes to pain, when it comes to high blood pressure, when it comes to a number of different diseases, so we make sure that these tools are really fully educated. Because if the benefit of these tools is that they can process a lot of information quickly, then we should utilize that by feeding it as much information as possible so that it's making decisions off as much education as we can feed.